Joining us right now is Wyoming Senator John Barrasso. He is the fourth-ranking member in the Senate. And Senator, it's great to see you today.
Hey, thanks for having me.
So where do things stand right now? I understand that you and the Senate are about to sit down and get an update from Health and Human Services Secretary Price.
Yeah, well, of course, the big headline today is that Humana has decided they don't want to sell health insurance anymore on the exchanges they're pulling out. The subheadline is that fewer people actually signed up for Obamacare for this year than they did last year. So this is a program that has failed. The costs have gone up and up. That's what I hear about in Wyoming every weekend. And the choices have gone down.
Senator,
what we need to do is provide repair.
Senator, one point of clarification. Those companies are trying to end their deal, at least say they're ending their deal, because the government won't allow the deal to go through.
They ended the deal to merge, but Humana has also announced they are out of the exchanges for next year, that they are not going to offer the insurance anymore because for them as a company, it's a bad deal, and people aren't buying because for them, it's a bad deal. So this, to me, is the complete failure of the Obama health care law.
There have been people all along who thought that Obamacare might collapse upon itself. Perhaps that's what we were seeing with Humana with some of the early situations. But no question, at this point, the Republicans are going to own whatever happens with it. So if you repeal it, what do you put in as a replacement?
Well, it took 6 years to get to this point, this downward spiral of the Obama health care law. We're meeting today with the Secretary of Health and Human Services, Tom Price. We met with Paul Ryan yesterday. The House and Senate are working closely together. We want to repeal the mandates that people have to buy this. We want to repeal the huge tax increase that the Obama health care plan put on people. And we want to replace it with patient-centered care. Do you want the government or do you want families to make the decisions? We want to get decisions out of Washington, back home to the states, and whether that has to do with insurance plans that you can buy so you can buy what works for you and your family at lower prices, whether it has to do with Medicaid, which is the government-run program, but states feel stymied in what they can offer. All of those things are on the table as we try to provide relief to the people who have been suffering under the Obama health care law.
Senator Barrasso, though, if you pull the individual mandate that forced people to buy this insurance, if you pull the Obamacare taxes that came along with this, that came with on wealthier people, it's going to be much more complicated to then turn around and offer health insurance to all the people who have it right now. The president has said that if you have insurance, you're going to continue to get that insurance. How do you make that happen? How does the math add up?
Well, for the people who have actually been paying more, or even those with the individual mandate, they're not buying. They're rather willing to pay the fine
instead.
Because the prices are so high. They're saying it's a bad deal for them personally. So the individual mandate itself has failed. It hasn't driven people in. It's driven people away. So you need to have a better solution, which is more individual choice, lower the prices so people can actually afford it, because what people are saying is even with the subsidies, it's still not a good deal. That's why we need to repeal the law, provide relief for people. I am committed as a doctor to actually finding long-term solutions for health care, and Obamacare isn't it.
Yeah, you're a medical doctor, for those who don't know it, and obviously you understand how the entire system works. But again, back to the price on how these things work, you're right. Prices were out of control on a lot of these. The price hikes for the insurance has been out of control on a lot of these issues. But if you want to continue to have no issues with people who are over 21 staying on their parents' coverage, if you want to make sure that there are no exceptions that are people who are ruled out for pre-existing conditions, I mean, it doesn't add up mathematically to have all of those things and still continue to offer affordable care.
Yeah, well, you know, my wife's a breast cancer survivor, so as a doctor as well, as a husband, I know how important it is for people with pre-existing condition to make sure they can continue with their insurance. But there are things that we can do to lower the cost, and it has to do with all of not just the mandates on people to buy, but the mandates on what they could buy.
Sure.
So there's these so-called essential health benefits that I think have driven the cost up dramatically. And we need to let states decide what they can sell in their state for the people, so people can buy what they want, what they need, what they can afford, not what President Obama said they have to have.
Senator, very quickly, if you're looking for some time frame on this, when should we be expecting some sort of repeal and replace or some sort of new plan that comes out?
Well, yesterday in our meeting with Speaker Ryan, he had said that the House is going to start markups in March. We're still trying to get the cabinet confirmed. You've seen the obstruction going on there, but we're holding hearings, holding meetings every day and continuing to work on ways to help provide some relief for some of the people that have been harmed by the Obama health care law and working toward repeal and replace.
Senator, before you go, do you think there should be an investigation around Flynn?
Well, I have big concerns about Russia overall, and we can spend a lot of time discussing that. But this is certainly, he's under investigation now, I think, by the FBI, and there will be additional investigations.
Should there be a special prosecutor?
Well, there are committees that are set up to continue with the investigation process.
All right. Senator, thanks for joining us today.
Thanks for having me.